look at what we really are talking about today. We are talking about fertility. Why are we even talking about this? Why are we all gathered here today? We are gathered here today because of its impact. What do I mean by impact? How do I give you an example of the impact? WHO has done that for us. What they have said is that after cancer and cardiovascular disease, this is the third thing which is going to be the burden of the society in the future. So obviously, this gives us enough indication to say that we need to be here, we need to be together, and we need to progress together. We all know this, that 1 in 6 couples actually face a fertility issue. But do we also know that this incidence is same as the people who have had stroke, who have had depression, or who have had prostate cancer? Well, not really, because there are so many campaigns going on about this, but how much of a campaign is going about the burden of infertility? There are a couple of surveys which have been done, and in fact, I think this has brought to light what we are dealing with in terms of the magnitude of the problem. One is with E&Y, and the other one is with the Allied Market Research. So some of the information that I'm giving you is coming from these two surveys. What are we talking about? You've already heard that the burden is pretty high. The burden in terms of numbers is looking at 30 million infertile couples. That's okay, we've got that number down. But what's allowing for us as a community is the fact that only 1% of these couples are actually going through in terms of treatment. So look at the need and look at the services that are being offered. So this is what we are looking at. 27 million, but actually the number of cycles that are being done is only between 1 to 2 lakhs. If you increase the actual numbers that are coming to the fertility centers, the cascade effect will improve the number of cycles that are going to be happening. Where are we in the global market? We're right there when it comes to the population, but where are we in terms of IVF market? Not very close at all. And like Mr. Durga was talking about, why should we be concerned? We are an overpopulated country as it is. We don't have enough resources for the people to feed. Should we be really looking at this? And the answer is obviously yes. The future of a country depends on its population, and if you really look at this graph and you see how fertility is declining, it is going to be something that we have to deal with very quickly. Now, there's another thing which you also have to put our attention to, that infertility is not a uniform problem. You have certain states which are actually doing poorer than the others. Why? We need to get the epidemiologist interested in this to understand why is it that certain states are doing worse off than the others. What is it that we need to control? What are the steps that we need to take, and how do we improve this? Now, we all know fertility is increasing, but what we need to take cognizance of at this point in time is more than female infertility, male infertility is actually galloping away, and we need to get our attention towards this. So having said all of this, what are we looking at? Infertility is no longer confined to the doctor's chamber. It is coming out. It is becoming a community issue, and that is the reason why we are all gathered here together. So who are the stakeholders when we are talking about how do we deal with this problem? Obviously the clinicians and the patients, but other than that, we are also looking at the lawmakers. We have to look at the regulation developers. We have to look at the entrepreneurs and the investors, and we also have to look at the pharmaceutical industry. So how do we get this all together? What are the challenges as we as doctors get to face? Mr. Durga had already pointed out, qualified and well-trained reproductive technologists. I think this is where the bottleneck is, and this is where we really need to work hard on. We need to streamline our workflow. We need to really keep getting updated with our advances in ART. So what is the action plan? Fellowship programs, in-depth, well-conducted fellowship programs. CMEs, to learn as well as to teach. Teach not just our fellow people, but also the pediatricians, the gynecologists, because these are the people who are actually seeing the girls right in their adolescence, right before they get into the reproductive age. There are lots of conditions that actually can be controlled or possibly even prevented, and some kind of alleviation done. What are we talking about? PCOD, endometriosis. This starts early, and unless we get into the action early, we are definitely going to catch them very late, and obviously the reproductive outcomes are going to be poorer. Now, a lot of fertility organizations and the office bearers are here as well. They have done great amount of work when it comes to actually bringing it out into the society. But what they also need is help from the government in terms of creating outreach camps, training up to the PHC areas, agenda for preventive care. So what are the issues faced by patients? Lots of them, but frankly, if we have to divide it, it is amongst these three. One, the cost, second, the access, and finally, lack of information. So how should we be tackling this? When we're really looking at cost, not all of us can afford to have jobs at American Express, which is actually giving them quite a bit of a bonus towards going for fertility treatments. Not everybody can be working in the Apples and the Googles of India. So what is it that we are actually looking at? When we are looking at this, and this again came from the survey, it said that 200 millions are below the level at which who can afford fertility treatments. Not all of them need fertility treatments, 10% of them do, which is still a sizable number. So we are looking at least 20 million of the people out there who require fertility treatments but are not able to afford it. So how? What is the action plan for that? The insurance companies really need to step up. We need to get some help from the employers. Don't know whether the government can actually get us some subsidies in this area. What about accessibility? It's already been covered. 55% to 60% of the IVF centers are still revolving in the urban as well as in the metro cities. We really need to get our penetration deeper. We need to have some outreach clinics. And when we come to information, it is very ironical that children are taught how not to conceive. What are the preventive measures they need to take so that they don't conceive? They are not taught what is important, which is what are the reasons subfertility is at a rise. And frankly, it is under these four things. There's a cultural and a social shift. There's late marriages, delayed childbearing, lifestyle issues, the bane of the society of now. We are talking about environmental pollution, and frankly, this is what is also causing the increase in the male infertility that we are seeing. Everything from hair creams to the tire that is on your automobile, everything is emitting toxins into the environment that we are living in. The air, the soil, the water that you drink, everything is polluted. Finally, lack of awareness. The lack of information on the various factors which is impacting fertility needs to be addressed. This needs to be shown. You have to understand that once you're crossing 30, your fertility is getting low. Now, 91% of people who came to the center, the first thing that they said was this: we wish we could have come sooner. They couldn't come sooner because they didn't know. So this is where we need to educate them, avoid stress, modify your lifestyles, and actually catch them early to give them the right kind of advice. What about the government? This is where we need to get it under the preventive care and the prevention care schemes. We need to start training at the grassroots levels. We need to see whether they can do some subsidy for the poorer sections. We frankly definitely need to work on the cleaner environment. Can we get some tax credits? We need to look at that. But please reduce the bureaucratic delay even in adoption, which could be one of the options for them. But the most important thing is this: enable regulations. What we are really looking for is involvement of all stakeholders in evolving an implementable, very important, and an enforceable law with a view on the advances that are happening in this rapidly growing field and also its introduction into routine care. This definitely needs to be tabled. It's been time. So when we're talking about all the stakeholders, where are we looking at in terms of the pharmaceutical industry? Guys, we need cheaper drugs. We need oral alternatives to the injectables. We need research funding. Entrepreneurs and investors, horses, gallop on, opportunities there for you. Where are we and what did we want to do in this field? We started off actually 9 years ago with just one center in Hyderabad, and right now we're about 9 centers. Why? Because of the need. How? Well, the key to that has been finding the right personnel, and it's very important to find the right people to help us. Let it be clinicians, embryologists, or the managers who are going to be the key factors here. And the second key is actually standardization of our protocols, revalidation of our clinical staff. This is a continuous process, quality control checks, and the continuous medical education. And towards education and towards training, this has been our second aspect of actually helping. And that is for the Oasis School of Human Embryology and Reproductive Medicine, which has actually managed to get 2 seats from the National Board for an FNB. And other than that, we are also tied up with the University of Health for our embryology courses. And other than that, we have a few other courses as well. And this has helped us in terms of the fellows to get into clinical studies, enhance their knowledge, and even contribute to the science. And this has been our third feather, and that is the information technology system. Why? Because we wanted to show transparency. We wanted to generate reports. We wanted to audit our results. And this kind of system has enabled us to do that. And finally, we did not want to miss the man. He needed the attention, and we are giving it to him in terms of Andro Life. And see, we are coming together today. But what we really need to do is work together, and that's what is going to give us the success. Thank you.